While the fight against the pandemic continues, it is the world's vulnerable people and nations that will bear the brunt. Will wealthier countries themselves struggling to contain the virus come to their rescue? And what will be the impact on those already affected by war and conflict? Hello and welcome to Bigger Than Five with me, Rida Fakhri. The coronavirus pandemic has hit some of the world's wealthiest countries the hardest so far. The United States, the world's largest economy, has the highest number of recorded infections. Among the 30 countries most affected, the majority are in the developed world. But the virus has also spread to developing countries, countries with weak health systems, and countries marred by years of conflict. One of those is Yemen, where the first case of COVID-19 was confirmed on April 10th. Aid agencies are warning that Yemen is critically under-equipped to face the virus following more than 5 years of war between Houthi rebels and a Saudi-led coalition whose bombing campaign has devastated the country's healthcare infrastructure. We begin in the capital Sana'a, where locals tell us about their challenges.
في حال انتشار المرض في اليمن ستسهم العادات الاجتماعية اليمنية وحالة النزوح التي أثرت على التركيبة السكانية إلى معدل انتشار عالي وسريع للحالات، وبسبب وضع القطاع الصحي الذي يعيش حالة عجز حقيقية في الوضع الطبيعي، بمعنى حالة إشغال أكثر من 90% لأشرة العناية المركزة وأجهزة التنفس الصناعي. سيكون معه الوضع نخشى أن يوصف بالوضع الكارثي، خصوصاً مع حالة عجز حالية بأكثر الأدوات المستخدمة للوقاية مثل الكمامات وأدوات التعقيم. هذه الآن تعاني أغلب المستشفيات اليمنية من حالة عجز ونقص حاد فيها في الوضع الحالي الذي يوصف بأنه لا توجد أي حالة في اليمن. مع دخول هذه الحالات نخشى أن يوصف الوضع بالكارثي.
نعم، إن الحجر المنزلي هذا لصالح الجميع، يعني لا علشان ما تنقلش العدوى لكن أنا إذا ما رحت أشتغل منين أكل عيالي ومنين أدي إيجاره؟ لذلك ما أنا مضطر إن أنا أخرج أشتغل لكي أكل عيالي وأسدد إيجاره، ومثل باقي الدول، لأن الدول الأخرى أعطت مواطنيها الرواتب والمساعدات، لذلك هم جالسين في البيوت. أما نحن فإحنا قد لنا 5 سنوات وإحنا في حرب، ما بش رواتب ولا بوشي، لذلك ما معنا إلا نخرج نشتغل بالأجر اليومي، فلذلك عندي أموت بالكورونا ولا أموت أنا وجهالي من الجوع.
For more now on the dire situation in Yemen, I'm joined by Chema Vera, Oxfam International's acting executive director. Chema Vera, Yemen is already facing what Oxfam has called the world's largest humanitarian crisis. Just how alarming would the spread of this virus be for the Yemenis, who have been already pushed to the brink following years of conflict and devastation?
It will be devastating. I mean, we just knew that there is one case that has been reported there. And if it spreads, it will be really awful. We are seeing now that 50% of health centers are not functioning. We know that almost 17 million of Yemenis have no access to clean water. We have millions of them that are living in IDP sites, in displaced camps. I was there 2 months ago, and I could visit some of them. Social distance is impossible there. It's impossible to keep basic health and basic public health, cleaning, washing hands. So this is something that if it comes, it will build into this crisis, and it will be a nightmare for Yemeni people.
So do you go as far as sharing other aid agencies' concerns and alarm when they say this could be a nightmare scenario, essentially a catastrophe within a catastrophe?
It is actually. I mean, in any refugee camp, the average use of one tap is for 1 for every 250 people refugee there. And the same happens in some of the displaced camps. We are trying as Oxfam and other agencies to increase our work with the communities, with the displaced people, to ensure that access to clean water and increase all our public health awareness raising campaigns, hygiene kits, and also looking for all the food security that will be challenged in the coming times. Because even if the coronavirus does not spread in a country like Yemen, there is already an indirect impact of this crisis. We were already being challenged in our humanitarian access to many of the displaced sites to move across the country, to bring international teams, international staff to support for the humanitarian work. Now with this crisis, what is happening in Yemen and in other countries with conflict or with crisis is that access to the sites will be stopped. There will be much more difficulties for cargo to reach, for international teams to get there. So already, even if the coronavirus does not come, hopefully it will not, there is a huge impact. That's why we are joining the UN Secretary General in his demand for a ceasefire in Yemen, in Libya, in South Sudan, and across the world of conflicts.
By the time this pandemic is over, Oxfam has said half of the world's population of 7.8 billion could be living in poverty, mostly in South and East Asia, in the Pacific, and Sub-Saharan Africa, where some 40% of countries are actually hugely indebted and likely to slide into a major debt crisis. And this was before the pandemic. You've been calling for major debt relief. Is that likely to happen?
It is starting to happen. We are just receiving some good news from the IMF meetings. Also, France was asking for debt cancellation of African countries. It's good steps, but this needs to really happen and happen across the G20 and multilateral institutions. We, as Oxfam, we are asking for two areas, two plans. One is a health rescue plan. It's for the Yemen countries and for 85 countries that as Yemen, have extremely weak health systems. They can't even cope with the normal functioning and normal diseases or those as cholera that comes. If then the coronavirus comes, it will be a nightmare, as we have said. So this is urgent. We are asking for 160 billion health rescue plan, and this has to be funded now to ensure that there are more doctors, that existing health systems are reinforced, that there is a huge revamp of hygiene, of public health, of hygiene campaigns, of outreach to the communities and to the camps. But then it comes, as you have rightly said, in the socioeconomic impact. We are already seeing people will starve before the coronavirus come because people live in daily salaries across the world, in India, in Kenya, in so many countries. So, and there is not, while we see in developed countries that there are several schemes and governments are bringing millions and millions to keep the economy going, to give safety nets for unemployed, for small businesses, for corporations. This can't happen. This will not happen in southern countries, generally speaking. So that's why
it won't happen, as you point out. So they are in a much more difficult situation. But let's face it, those wealthy countries as well that you're calling on to help to cancel the debt of low-income countries, the G20 and others, their own communities are also suffering the economic consequences of this pandemic. Do you believe that the approach of many of the wealthier countries toward the world's poorest will have to change as a result of this pandemic?
We definitely are demanding this, and I think it will happen. I'm hoping that it will happen, and I'm saying this because I believe in humanity, and I think this is a global crisis. We are all facing it. We are facing in Spain, in my own country, we are seeing it. So that a human empathy and connection with what means a health emergency that is happening now very close to our neighborhoods, but then we can understand what is coming, has already been a huge crisis in some countries. So that's why I do hope that we will face it globally, and also because of our self-interest. I mean, the virus has to be out of everywhere. So this is the only way we can get it safe for all of us.
Chema Vera, Interim Executive Director at Oxfam, thank you very much for joining us. We now turn to Palestine, where the number of infections continues to rise. A state of emergency was declared in early March and a lockdown imposed. But with Palestinian workers returning from Israel, where more than 12,000 cases have been reported, the virus continues to spread. So how are Palestinians coping with this? We went to Bethlehem to find out.
التحديات احيانا بتكون صعبه. احدى ابرز هاي التحديات اللي هو الاستهلاك العالي للمواد والمستحضرات الطبيه اللي بتكون موجوده عندنا. الحمد لله موجوده، ما صارش عندنا نقص فيها، لكن بتكون في استهلاك عالي لها. في عندنا صعوبات اللي بتكون مرتبطه بالواقع السياسي والجغرافي عندنا في مناطقنا الفلسطينيه. بتعرف احنا مش كل المناطق بتخضع للسيطره الامنيه الفلسطينيه الكامله، فاحيانا نضطر نتحرك في مناطق محاذية للمستوطنات. عمالنا جزء كثير، يعني عندنا 60,000 عامل فلسطيني بيشتغلوا في الداخل الفلسطيني، عدا الأشخاص اللي بروحوا للداخل الفلسطيني سواء للعلاج، لعمل، لزيارات، لأشياء زي هاي. كلهم هدول بيكونوا عرضة من خلال زياراتهم للمناطق الموبوءة إنهم يرجعوا للمناطق الفلسطينية وينقلوا المرض لها. وهذا اللي قاعد بصير عندنا حاليا، إن كل الحالات اللي قاعدة بتظهر عندنا في الضفة الغربية هي نتيجة استيرادها من إسرائيل، أو هي حالات مستوردة من إسرائيل. وطبعا تعرف كفلسطينيين مع الأسف في شيء سيطرة كاملة على هاي المعابر وعلى هاي الحدود. فهي بتكون من أبرز التحديات اللي بتواجهنا كطواقم فلسطينية، لأن الإسرائيليين مش مسيطرين على الوضع عندهم، في أحيانا بتكتموا على المعلومات الموجودة عندهم، فبخلق إرباك عندنا هون.
في الحقيقة لا يكفي، يعني لا يوجد مستشفيات في بيت لحم تكفي في حال ازدياد الإصابات إلى عدد أكثر من ما هو عليه الآن. ولكن في إجراء احترازي، وخاصة في الموجة الثانية المتوقعة من انتشار الفيروس في محافظة بيت لحم نتيجة عودة العمال الفلسطينيين العاملين في داخل الأراضي المحتلة عام 48، اتخذنا قرارا بحجز كافة الفنادق الفلسطينية في محافظة بيت لحم، ووضعها تحت تصرف وزارة الصحة من أجل حجر العمال الفلسطينيين العائدين من الأراضي عام 48 في هذه الفنادق، وخاصة تلك الفئة التي يمكن أن يظهر في الفحص الأولي أنها مصابة ولا يظهر عليها أي أعراض لهذه الإصابة. وبالتالي تم أخذ قرار بحجرها بالفنادق فترة الحضانة من أجل التأكد من خلوها من أي أعراض، أو انتهاء فترة الحجر 14 يوم، بالتالي إعادتها إلى بيوتها وإلى أهلها.
أنا في مخيم عادي طبعا بنشكل حالة وحدة حال طبعا، وفي حالة تكاتف وتعاطف بين الناس. في ظل الأسف تخلي وكالة الغوث عن مسؤوليتها تجاه مخيم عادي. وكالة الغوث وأقولها يعني بصراحة، وكالة الغوث تتخلى عن كم مسؤوليات داخل مخيم عادي، عن الخدمات الصحية، الطبية، مواد التنظيف، التعقيم داخل المخيم، أي شيء، من حتى العلاج. في نقص في العلاج يعني، والأدوية بشكل يعني قاطع. العلاج حتى غير متوفر في مؤسسات وزارة في وكالة الغوث. العلاج أقل شيء، حتى الضغط السكري. وكالة الغوث تتخلى عن كل مسؤولياتها.
For more now on how Palestinians are dealing with this pandemic, I'm joined by Dr. Hani Abdeen, who was the Palestinian Authority's health minister from 2012 to 2013. He is now the dean of the Al-Quds Medical School in East Jerusalem. Dr. Abdeen, there's a strikingly low number of recorded infections across Palestine. Is it due to the strict measures the Palestinians put in place since the beginning of this pandemic, or is it because of the more limited testing that's available?
Well, I think mainly it's due to the severe lockdown that was really put in by the Palestinian ministries and the Palestinian president, who really went for an early lockdown, which prevented from any increase in the numbers of coronavirus infections. Also, we have to admit that we don't have good testing methodology in order to ascertain the incidence of the disease in the community. But all the same, I think the early lockdown that we preceded most other countries in the Middle East had really a major effect in controlling the spreading of the virus among our community.
So you mentioned the early lockdown. You also touched on the fact that there is a limited supply of medical equipment, perhaps, to deal with this. What is the situation like today across Palestinian hospitals? I know that the health ministry has said that there are only 250 medical ventilators. Is that the case, and is that enough?
That's true. I mean, the most important thing, if we want to know exactly how many patients we have with the COVID-19 virus, unfortunately, we don't have the testing or the number of kits required to do the testing. I think we have probably the people who can do the testing, but we lack the kits and the consumables in order to carry out a large-scale testing on our population. As far as the healthcare sector in Palestine, as you know, we are still under occupation. I don't think we can say that we are a free, autonomous country that have access to the outside world in order to import what is needed by the medical health sector. So yes, true, we don't have enough ventilators. We only have between 180 to 250, depending on which statistics you follow. But the number are quite low if we consider that the pandemic is going to take a further foothold in the Palestinian community as a result of the workers who work in the Israeli sector and come back to the West Bank and Gaza. These are the people who are now introducing, unfortunately, the farsa.
So given the constraints that you face, are you able to produce some of these ventilators? Al-Quds University, I understand, is developing a prototype. Do you have the materials? Do you have the expertise you need?
Al-Quds University has really sort of jumped on the bandwagon to help the Palestinian health sector by making a prototype of a ventilator that can be used locally and that was devised by local consumables and parts that are available in our community. And I can say for certain that in the next week, we will have the full approval of the institute, the Standards Palestinian Institute for that ventilator, which we can use in our hospitals. Now, if you say, can we produce it on a large scale?
Are you able to produce it on a large scale? And can you, Dr. Abdeen, deal with the situation facing the thousands of Palestinian workers who return from Israel and who account for more than a third of coronavirus cases among Palestinians? Do you think that the Palestinian government needs to take certain measures, perhaps even stop migrant workers from going to Israel in order to contain the spread of this disease?
I think this is the logical policy, that if these people are the ones who are really bringing the virus to the community, the Palestinian community, then the best answer for that is really to stop them from going there and preventing the virus from spreading. But as you know, we have to weigh again the health reasons against the economic reasons. And definitely one of the best approaches is really to stop these workers and finding a way to support them from the Palestinian government.
Dr. Abdeen, I'd like to ask you finally about the situation in Gaza. We all know it is known for having one of the highest population densities in the world. Physical distancing for many Gazans is out of the question. What would the spread of COVID-19 mean for the many Palestinians who are living in overcrowded conditions in Gaza, the refugees who are depending on UNRWA for some of their most basic needs?
I think it will be a big disaster, and Gaza is in an unenviable situation. And I think the measures they are taking, although they are having some success with it, but again, unfortunately, due to lack of testing, we don't really know the incidence of the disease among the population. But if it is going to spread on a wide scale, as people are anticipating, then we are in for a big disaster. And from here, I really try and say and advise people to lift sanctions against Gaza people, to make them really have all the necessary equipment, all the necessary means to test the people, and all the necessary medications in order to cope with this situation. So this is really a very unfortunate situation for Gaza, and we have to appeal to all the world and all the human kindness in this world that Gaza should be treated differently from the way it is being dealt with at the moment.
Dr. Hani Abdeen, many thanks for joining us. The leading medical humanitarian organization, Médecins Sans Frontières, or Doctors Without Borders, is on the front lines, assisting refugees and vulnerable communities in conflict areas. Dr. Christos Christou, the international president of MSF, joins me now. Dr. Christos, for the first time, air travel is virtually at a standstill. Borders are closed. How are you and your teams of medics throughout the world able to cope with the current restrictions that are in place? How are you able to assist those most in need?
Indeed, these are the main concerns that we have at this moment, and I would summarize them into three main topics or areas. The first one is related to how we mobilize our staff. The second is how we can better mobilize our supplies. And third, and more important at this right moment, I would say, is the shortages that we experience in the personal protection equipment, which is very important. Without this, we cannot carry on with even the already existing activities and the programs that we run around the world.
In late March, though, you did say that you were facing massive challenges, that your human resources were trapped in their own countries. Has that situation changed? Have the travel restrictions eased to a certain extent? I know you were in discussion with several European governments. At the end of the day, like everyone else, I assume you have to prioritize. What are your priorities then?
That's true, and I don't see much improvement since last time that we expressed these concerns. And the problem is that each and every one of the countries have different restrictions, different measures, and that has created a lot of confusion on how we can better mobilize our people. So at the moment, I'm afraid that the situation is more or less still the same. Our people are trapped, if I'm allowed to say so, in their own countries. And it's not easy, not even to move our people from the same region, from one, let's say, country or another, or one project to another. How we do at the moment? We try to adjust also ourselves in this new reality, and we try to experiment on new models of operating. You may understand that it's very important, the use of technology at this moment, and we have had already started providing telemedicine support to all our projects before. So now it is a little bit more easy to spread it. However, this is something that will still be under constant monitoring.
And some of the groups that are heavily dependent on you are refugees who are forced to live in these overcrowded, often very unsanitary conditions. Just last week, the Italian government made the decision to close off its ports to incoming migrant rescue vessels. You and other leading NGOs actually condemned that decision. But to what extent are governments able to balance between the needs and the safety of their own citizens and those of incoming flows of refugees and internally displaced people who are trying, or migrants who are trying to reach their shores?
Thank you for your question. It is very important to remind to everyone that this is a disease that should not leave anyone behind. It's a global problem and requires a global solution. And every and single part of this population should be also included in the way that we address the problem. So we desperately need to remind to everyone that neglected populations around the world are even more in need at this moment of our support. And because sometimes epidemics are by their own nature divisive, we need to remind to everyone that there is no place for stigmatization at this right moment.
And as you've said before, the idea of self-isolation is itself a luxury, as it is, in fact, for so many people living in slums in the third world. How much access do you have to other refugees and IDP populations? I'm thinking about the Rohingya in Cox's Bazar, Somalis in Kenya, Syrians. The list is long.
The list is very, very long. It's, as you said, Cox's Bazar. It is the slums in Brazil. They are the informal settlements in Mexico. And let's come back also to our area in Greece. We know what's going on in the Greek islands at the moment, where people have not the luxury, of course, to self-isolate. They don't have hygiene conditions. And these are basic things that if you don't have them, then you cannot apply any of the measures. I'm afraid that at the end of the day, we may do more harm than good. So in all these places, what we urgently ask and request is the immediate evacuation, starting with the most vulnerable part of the population there, And by a first step to move them in the mainland of Greece, for instance, and then, of course, the whole Europe should assume the responsibilities of all these people.
And I know that you yourself have worked as an emergency trauma surgeon in many conflict areas, including Afghanistan, Libya, Syria, Iran, and Yemen, and many other countries where MSF medics are trying now to assist those in need. Dr. Christou, thank you very much indeed for joining us. There is no doubt the coronavirus has shaken the world to its core. It may yet inflict more devastation on communities already devastated by war. And while each government struggles to keep the virus at bay, the velocity of this pandemic is quickly demonstrating a weighty new reality. It cannot and will not be defeated at home unless it is eradicated everywhere else. From me, Rida Fakhri, and the entire team here in Washington, thanks for watching. We'll see you next time.